we're covering the crucial topic of urine specimen collection types for your phlebotomy technician exam. The exam will test your knowledge of not just the different types, but the specific procedures and handling requirements for each. Let's start with the most common types. A random specimen can be collected at any time and is used for routine screening. A first morning specimen is collected immediately upon waking. Because it's the most concentrated, it's the preferred sample for tests like pregnancy screening and bacterial cultures. The exam loves to ask about the midstream clean catch procedure, which is vital for preventing contamination. For female patients, the procedure involves separating the labia and cleansing the area with antiseptic wipes, wiping from front to back. The patient then voids a small amount into the toilet, stops, and then collects the midstream portion in the sterile cup. For male patients, they must retract the foreskin if uncircumcised, cleanse the head of the penis, start urinating into the toilet, and then collect the midstream sample. The key is collecting the middle part of the urine flow to flush out initial contaminants. Now for the most tested and most confusing type, the 24-hour urine collection. This is used for quantitative analysis of substances like hormones or creatinine. The exam will absolutely try to trick you on the timing. The process begins when the patient wakes up, completely empties their bladder into the toilet, and discards that first specimen. That exact time marks the start of the 24-hour collection period. The patient must then collect every single drop of urine for the next 24 hours, including the very last void at the end of the 24-hour mark. A common exam trap is asking what to do if the patient accidentally misses a collection. In that scenario, the entire 24-hour process must be stopped and restarted from the beginning. During the collection period, the specimen must be kept refrigerated or on ice. Two specialized collections are suprapubic and catheterized. A suprapubic aspiration involves a physician inserting a needle directly into the bladder to obtain a completely sterile specimen, often used for infants. For a catheterized specimen, the critical point for your exam is that the sample must be taken from the collection port on the catheter tubing, never from the collection bag, which contains old, unsterile urine. Regardless of the collection type, remember this rule. Specimens must be tested or refrigerated within 2 hours of collection to prevent bacterial growth and chemical changes. To remember the tricky 24-hour rule, use this phrase: first one out, last one in. That's how the 24-hour test will win. It helps you recall to discard the first void and collect the final one. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.